from his paper. It is obvious that the existence of a competing free market constitutes a continuous threat to the operation of a socialist public service, however heavily subsidized by taxpayers' money. The element of quality that derives from patients' personal preference for and confidence in certain doctors cannot easily be done away with so long as people are willing to pay for a free choice of physicians. To do away with such opportunities, therefore, has become a new goal of Swedish healthcare politicians. The introduction of these various regulatory processes has resulted in a cancerous growth in the numbers of medical administrators at all levels of incompetence. The Board of Welfare, I go on quoting, has recently issued a 60-page book trying to describe how to calculate the number of physicians needed to cover the necessary staff of any one clinical department. The book is a fascinating monument over the total absurdity into which legislators, administrators, and trade union representatives have finally brought a previously simple and efficient machinery. The setting in which medicine has been practiced during thousands of years has been one in which the patient has been the client and employer of the physician. Today, the state, in one manifestation or the other, claims to be the employer, and thus the one to prescribe the conditions under which the physician has to carry out his work. These conditions may not, and will eventually not, be restricted to working hours, salaries, and certified drugs. They may invade the whole territory of the patient-physician relationship. If the battle of today is not fought and not won, there will be no battle to fight tomorrow. Coming back to the United States, I need not tell the people in this room what has been happening in American medicine. I've already mentioned the growth of Medicaid and Medicare, but you all know about PSROs and HMOs and about the proposed lid to be placed on hospital costs. And this morning's newspaper carried a story that President Carter was planning to introduce into Congress a bill for national health insurance sometime in the near future. The argument is being made that all of this is necessary because there has somehow been a terrible rise in hospital costs, which the American people either cannot afford or which can somehow be eliminated by wise government bureaucrats. Most of these stories always deal with the benefits that will be received and say nothing about who is going to pay the cost. There is only one source from which the costs can be paid, and that is the American people. The only question is whether they are going to be mediated through bureaucrats with a substantial discount being taken off for cash, or whether they are going to be spent directly by people on their own behalf. So far as the rise in hospital costs, part of it is undesirable and unnecessary. Part of the rise in hospital costs has been a result of the expansion of governmental spending on Medicare and Medicaid, with the result of the many scandals that we have had in this area, and with upward pressure on prices. But in the main, the rise in hospital costs reflects primarily the decisions on the part of millions of American citizens about what they want to buy. It reflects one of the great American innovations, the spread of voluntary, private, hospital and health insurance among the population at large. The major reason for the rise in costs per day of hospital care is not a rise in prices in excess of inflation, not at all. The major reason is an increase in the number and the variety and the complexity of the procedures that are being used, of the tests that are being made, of the services that are being rendered to the American citizen. The costs of hospital care have been going up for exactly the same reason that the amount of monies being spent on automobiles went up during the 19th and 20s and 30s. Because in the main, the public at large has wanted to buy more medical care. And the market has been responding to their demands. The costs have not been rising primarily because hospitals are inefficient. I have no doubt they are. But they've been inefficient all along. There's been no great increase in their inefficiency. The costs of medical care have not been rising because physicians are grasping. Of course, physicians are grasping. So are all of us. We're all of us greedy. But they haven't become more grasping and more greedy. No, the main reason for the rise in costs is because there has been pressure to expand services and provide a different variety. Now, maybe customers have been silly. Maybe they've been foolish in wasting their money in various directions. But I think one of the freedoms we still ought to preserve in this country is the freedom for people to be foolish with their own money. Now, the question is, what is the answer? In the first place, is there any role for government in the medical care field at all? In my opinion, there is no special role for government in the medical care field, with the exception of the public health activities of government where there is a special problem. But I'm now talking about private medical care, about medical care of individuals. I believe there is no special role for government in the medical care field at all. That there is the same role for government in this area that there is in every other field. And indeed, I started out by emphasizing what has been happening in medicine does not derive from anything special to medicine other than the activities of the AMA. It's been applying, after all, across the board. It's been part of the general trend, whereby it will take another 10 days before people in the United States can stop working to pay the expenses of government and can start to work to pay their own expenses. What is the role of government in the medical care field as in other fields? To enforce laws against fraud and deception, to help people who are in dire distress. There is an argument to be made about the fact that some people may not be able, on some occasions with emergencies, to stand the very large major medical bills. Just as some people may be in dire distress because they lose their homes with a flood or a hurricane. Some people may be in dire distress because they become disabled or otherwise. Insofar as the government has programs to assist people in dire distress, it ought to include people in dire medical distress. But I think there is no other special role. For ordinary medical care, there is no case for government financing at all. The costs of ordinary medical care are well within the means of the average American family. And the problem of sometimes it's being large and sometimes it's being small is currently readily handled through the availability of private insurance arrangements. 80% of all hospital bills today are being paid through third-party payments on insurance. I have no doubt that those insurance arrangements could be improved. I have no doubt that they will. This is a field in which innovation is still going on. I myself believe it would be desirable to have greater major medical coverage, to have larger deductibles, more co-insurance arrangements, and other devices. Those are details. They can and will be improved. But insurance enables every family in the United States, except those who may have to be on the public purse for other reasons, to provide for its own medical care. Let me point out that although the private expenditure on medical care has been growing as a percent of income, as people have become more affluent and have wanted to spend more of their money on medical care, yet total expenditures on medical care is less than 2/3 as much as total expenditures on housing. It's less than